People have probably heard that there were 2 cases of healthcare workers in the United Kingdom who had anaphylactic reactions. They were both workers who had a history of severe allergies. They had EpiPens. They used those EpiPens and they recovered and were fine. But, as a result, that's drawn a lot of attention to the question of whether these vaccines are safe for people with different types of allergies. So can you maybe talk to that a little bit?
Yeah, that's really the interesting question this week. Neither the Pfizer or the Moderna vaccines had any kind of allergic reaction show up in the clinical trials so far. But this is maybe not a total surprise because even though those trials are looking at tens of thousands of individuals, they're not looking at, hundreds of thousands or millions of people. So as time goes on, there may be more rare reactions that start to emerge. The question with the Pfizer vaccine, why were these allergic reactions? Why did they occur? And what were the ingredients inside the vaccine that might have been reacting to? With the Pfizer vaccine, well, in fact, with both of them, the list of ingredients is pretty short. I was basically in the heart of it is that messenger RNA. Really hard to imagine that has anything to do with the allergic response because basically our cells are full of messenger RNA. Then the vaccine is encapsulated in that lipid layer, which helps it penetrate into cells. That's maybe a more likely candidate for where there might be an allergic response. And then the whole thing is in kind of a buffer, sort of a solution, which is mainly different kinds of salts and sugar. So nothing there that is in any way new in the vaccine world or surprising. So it's a limited list of ingredients, and that's where things are looking at right now. So if you're a person who carries around an EpiPen, is prone to allergic reactions, obviously worth asking about that. And this is why it may prove to be important down the road that we have other options with vaccines. These are not the only 2 vaccines. Canada has also ordered 5 other vaccines. So it may be that down the road, there will be other vaccines that are more suitable for different people.
One thing we got quite a few questions about was about these vaccines and pregnancy and fertility. So what Health Canada has done in their sort of directions for the vaccine is say, we don't know yet whether this is safe or effective for pregnant women. We just don't know. We don't have the data. So if you're thinking about taking this, have a conversation with your doctor. And what doctors will probably do is refer to something called the National Advisory Committee on Immunization, which is an expert panel that looks at sort of all things related to vaccine. And their advice right now is if you're pregnant, you shouldn't take this vaccine. They say, however, though, that if you want to have a conversation about this with your doctor, at the end of the day, the decision should be up to individual women. And the reason why this really matters is the virus itself, not the vaccine, is a risk factor for pregnant women. We have some pretty good data at this point that suggests that women who catch the virus while they're pregnant are likelier to have severe outcomes. So they're likelier to wind up in hospital and they're likelier to wind up in ICU than women of similar ages who are not pregnant.
At what point can we consider herd immunity good enough to go back to normal? Quick answer to the question, it actually has to do with what's called the reproduction number of the virus. If no interventions were made and people just went about their business, every case on average of COVID-19 would produce another 2.5 cases, again, on average. We know there's a lot of variability there. There are super spreaders. There are some people who don't spread it at all, and that's also unpredictable. However, given that reproduction number, the estimates are that you're going to need somewhere around 65 to 75% immunity in order to really have that pandemic finally wrestled to the ground to prevent ongoing spread. So that means there's going to have to be, a lot of acceptance of the vaccines. We certainly don't want to get to herd immunity the other way, which is just lots and lots of people getting sick and a correspondingly large number of them dying as well. And of course, this is not a Canadian issue or a North American issue. It's a global issue. Somehow that rollout of the vaccination and immunization effort is going to have to reach the entire world, because as long as there's a pandemic somewhere, basically there's a pandemic everywhere.